Thank you so much. Well, March is Women's History Month, and it will be in April in just a few days, which marks Informed Women's Month. That encourages awareness of inequalities present for women, including those found in healthcare. Dr. Holly McKenna, an integrative psychiatrist with Dara Wellness, joins us now. Good morning, Holly.
Good morning.
Well, thank you so much for being here this morning. You know, I guess the first question is, how much of a role does gender and sex play in healthcare outcomes?
Well, we found that both gender and sex there's inequalities and inequities for that and for all really marginalized populations in medicine. And part of this is due to the lack of research. The FDA actually wouldn't allow research on women because of concerns about their sexual health until the mid-90s. And it wasn't until as recent as the late 90s, early 2000s that it was mandated that women and minority populations be represented in research. So current research only has just over a third of those studies that have representations of women, minorities within the populations being studied. So what happened is that white men and the results of white men were generalized to all the rest of us. And we've come to realize since doing more research that that isn't going to give us good health care. Right. So basically our sexual differences are not just about our reproductive organs. It also affects our physiology, our metabolism, how diseases will present, and how we will respond to treatment.
Sure.
So all of these things need to be kept in mind. So given that, we've seen a real bias in areas such as cardiology. If a woman has an emergency, she is much less likely to have CPR performed by passersby. A woman may have a perception by healthcare workers that she tends to complain more about pain and that men are more stoic about pain. The studies have found. This isn't necessarily true, but that's what the bias has been.
And then, you know, after childbirth as well, you know, women are often not taken seriously. And I don't want to say often in that this is like a pervasive, every OBGYN is not listening, but sometimes there's these biases that these doctors may not even realize they have.
Well, and in maternal health, it actually is important to note that we have an increasing rate of maternal deaths, both during childbirth, postpartum, during pregnancy, and it's due to an inequity in care. People can't access the care. It's not affordable. It's becoming less accessible. And unfortunately, we're seeing the rates go up because of that.
Yeah. So what can we do to change this? I mean, would having more women in healthcare, having more minority groups in healthcare, you know, kind of representation matters? Like, would that help?
Absolutely. Yes. This is kind of my personal platform. I am both a patient and a physician. So I found that empowering patients has been super important. And I think my being on both sides of the equation has been super helpful for folks because they know that I hear them when they say that my pain isn't being taken seriously because I've been there. And that's true for folks who are in marginalized populations as well. So there really is a need for change in the training to allow for those populations to have more access to the training and to become physicians. When folks are seen by their physicians, they can do things to make sure their voices are heard. One thing that I always recommend is to make a list of what's important to you.
Sure.
I'd make a list, write it down, and then actually rank it. So you might go on with 3 things that you're complaining about, and your doctor hears you and maybe prioritizes something based on what is life or death. Like if you're saying I'm depressed, I have high blood pressure, and my pain is really, you know, I'm really worried about this knee. And maybe the knee is your primary concern, but they're going to address the depression and your blood pressure.
Sure.
That way, if you have it written down and, you know, emotions get in the way, anxiety, you know, the doctor's often rushed,
sure.
Right, then you can make sure, wait, I have on my list, I need this pain addressed. And honestly, the doctor wants to hear that because if they don't have that connection with you and address your primary concern, you're less likely to do what they're concerned about, which is take your blood pressure medicine and address your depression. So it really needs to be a partnership, and that's one step you can do. You also really have rights when it comes to giving consent. So if you're about to have a procedure or go through a test, it's okay. And actually, I encourage you to ask your doctor, why is this happening? What are you looking for? What would the results tell you? How will you act on these results? Because that's going to inform you as to whether or not you want to even have the procedure or testing, because maybe the results will tell them about having a surgery that you don't intend to engage in.
So it may not be worth even doing.
Right. You're also allowed to, when you're consenting for a surgery, to ask exactly who's going to be in the room, what type of procedures are going to be done on you, and you can take away consent for trainees or for an exam that maybe you don't want to have happen when you're unconscious. And you're allowed to have a nurse or someone there who acts as a chaperone and as your advocate when you are in anesthesia. You can ask for that, and I encourage you to ask for that.
All amazing tips. Thank you so much, Dr. Holly McKenna, for joining us and for those great tips as always.
Thanks.
Appreciate it. Well, get ready to